Mental disorders aren't what you think they are. When we say mental disorder, many people imagine something rare, dramatic, or completely separate from normal life. But in reality, mental disorders are extreme versions of patterns your brain already uses every day. So what actually separates normal stress, sadness, or quirks from a diagnosable mental disorder? Mental disorders are patterns of thoughts, emotions, or behaviors that cause significant distress or interfere with daily life. Everyone feels anxious before a test, sad after a breakup, or distracted during a boring lecture. But sometimes those feelings don't switch off. Sometimes they grow, spread, and start running the show. The big question is, what actually happens in the brain and mind during a mental disorder, and how do scientists classify and understand them? Along the way, we'll answer smaller questions too. Are mental disorders just chemical imbalances? Are they permanent? And how common are they, really? Think of your brain like a highly advanced control center with thousands of settings: mood, fear, attention, motivation, memory. Most of the time, these settings adjust smoothly to life. A mental disorder happens when one or more of these systems gets stuck on too high, too low, or out of sync, and it starts disrupting everyday functioning. Scientifically, a mental disorder is defined as a clinically significant disturbance in cognition, thinking, emotion regulation, or behavior associated with distress or disability. That definition comes from major psychiatric guidelines used worldwide. Common misconception: people often think mental disorders are just weakness or bad personality. In reality, they involve measurable changes in brain activity, genetics, stress systems, and learning patterns. They're not a character flaw, they're a health condition. That's the anchor. Mental disorders are disruptions in how the brain regulates thoughts, emotions, and behavior. Mood disorders, when the emotional thermostat breaks. Mood disorders are conditions where a person's emotional baseline is stuck too low or swings to extremes. Take depression, for example. Everyone feels sad sometimes, but major depressive disorder involves persistent low mood, loss of interest, sleep and appetite changes, fatigue, and difficulty concentrating for at least 2 weeks, often much longer. Brain imaging studies show altered activity in regions involved in emotion regulation, like the prefrontal cortex and limbic system. Then there's bipolar disorder, where mood shifts between depressive episodes and periods of mania, abnormally elevated or irritable mood, high energy, reduced need for sleep, and impulsive behavior. It's not just being moody, it's a severe shift in brain-driven mood regulation. Light human angle. If normal mood is a dimmer switch, mood disorders are when someone replaced it with a broken light switch that only knows pitch dark or stadium spotlight. Mood disorders are about prolonged, disruptive changes in emotional regulation, not just everyday ups and downs. Anxiety disorders, when the alarm system won't turn off. Anxiety is your brain's built-in alarm system. It evolved to keep you alive. But in anxiety disorders, like generalized anxiety disorder, panic disorder, or phobias, that alarm system becomes oversensitive. The amygdala, a brain region involved in detecting threats, can become hyperactive. Because the brain perceives danger, the body responds: racing heart, sweating, muscle tension, shallow breathing. The key difference is persistence and intensity. In generalized anxiety disorder, for instance, worry is excessive and difficult to control for months. In panic disorder, sudden waves of intense fear occur without real danger. It's like having a smoke detector that goes off not just for fires, but for toast, steam, and possibly strong opinions. Anxiety disorders happen when the brain's threat detection system overestimates danger and won't power down. Psychotic disorders, when perception detaches from reality. Psychotic disorders involve disruptions in how a person perceives and interprets reality. In conditions like schizophrenia, individuals may experience hallucinations, perceiving things that aren't there, or delusions, strongly held false beliefs despite evidence. These are not simply imagining things. They reflect altered brain signaling, especially involving dopamine, a neurotransmitter that helps regulate reward and meaning. Scientists believe psychosis may involve the brain assigning too much importance or salience to random thoughts or events. When neutral stimuli feel deeply significant, the mind tries to explain them, sometimes in ways that don't match reality. A respectful reminder: these experiences are deeply distressing for those who have them. They're medical conditions, not personality quirks. Psychotic disorders involve disruptions in perception and meaning-making, often linked to altered brain signaling. Neurodevelopmental disorders, when wiring develops differently. Neurodevelopmental disorders begin early in life and involve differences in how the brain develops. Conditions like attention deficit hyperactivity disorder, ADHD, involve persistent patterns of inattention, hyperactivity, and impulsivity. Research shows differences in brain networks related to attention and executive function, the system that helps you plan, focus, and resist impulses. Autism spectrum disorder involves differences in social communication and restricted or repetitive behaviors. Brain development patterns differ in connectivity and sensory processing. These are not bad behavior. They reflect differences in neural wiring that appear early and affect daily functioning. Imagine trying to tune into a radio station, but the frequency is slightly off. The music is still there, it just comes through differently. Neurodevelopmental disorders reflect early brain wiring differences that affect attention, behavior, and social interaction. Personality and trauma-related disorders, when patterns become rigid. Personality disorders involve long-standing patterns of thinking, feeling, and relating to others that are inflexible and cause problems across situations. For example, borderline personality disorder includes intense emotional swings, unstable relationships, and fear of abandonment. These patterns are linked to both early experiences and differences in emotion regulation systems. Trauma-related disorders like post-traumatic stress disorder, PTSD, develop after exposure to traumatic events. The brain's memory and fear systems become strongly linked, so reminders of the event trigger intense emotional and physical responses. Because the brain is trying to protect the person from danger, it stays on high alert even when the danger is gone. Myths versus reality. Myth 1. Mental disorders are just chemical imbalances. Reality: brain chemicals like serotonin and dopamine play roles, but mental disorders are more complex. They involve brain circuits, genetics, stress, learning history, and environment, not just one molecule. Myth 2. People can just snap out of it. Reality: because these conditions involve brain function and deeply learned patterns, willpower alone usually isn't enough. Treatment often includes therapy, medication, or both. Myth 3. Mental disorders are rare. Reality: they're extremely common. Globally, about 1 in 8 people live with a mental disorder at any given time, according to major health organizations. This isn't unusual. It's part of human health. First, understanding mental disorders reduces stigma. When you know they're rooted in brain and psychological processes, it's easier to replace judgment with compassion. Second, it improves early recognition. If you can tell the difference between temporary stress and an anxiety disorder, you're more likely to seek help sooner. Early treatment often leads to better outcomes. On a personal level, knowing how mental disorders work helps you understand your own mental patterns. You may not have a diagnosis, but everyone benefits from better emotional regulation, stress management, and awareness of when to ask for support.
Mental disorders aren't mysterious forces from outside the brain. They're what happens when very human systems go out of balance, and understanding them is the first step toward restoring that balance. Which category surprised you most, or changed how you think about mental disorders? If you'd like more complex science topics explained simply and clearly, consider subscribing for future deep dives into how the brain really works.